Out of favour. That's right. Died out of favour, and some 25 years ago, a famous osteopath called A.L. Lederman that reintroduced it, did a PhD on it, and evidence-based it basically, and now lectures internationally on it. It's a really, really nice technique. The good thing is, it's good for acute and it's good for chronic. It's good for discs, it's good for pretty much everything. And the nicest thing about it, it's actually, if it's hard work, you're doing it wrong. So a win-win situation, okay? So, client is side lying, okay? And if you want disc or, lesion side up, but not necessarily, so you don't have to stress about it. You can't tell, okay? So what you're going to do is cause a push articulation like that. Now, that's what I'm trying to do. So we picked this lady because she was saying she's a quite sore back and she's quite fragile at the lumbosacrum. So Bill, the case we had for the PVL, this would be a type of technique you do some of. And the thing about it is, it doesn't need massive diagnostic or accurate diagnostic skills. You're just creating a subtle side shifting, allowing the local ligament and capsules to stretch. That will allow the local hypertonicity to reduce, and that will allow a return to a homeostasis. How long do you do it? A couple of minutes at a time. You could do 3 or 4 times in a session. It's quite a flexible technique, but it's not hard work. And I'm not doing that, pushing her through it. I'm just gliding her through it. Again, if you're doing it wrong. It's easy. Now, it's not this. You're not at home making bread. Your body's going with it. Your elbows are tucked in. Now, can you tell us how it feels to you?
Nice.
It's soothing and relaxing, and if it's a disc, and we were talking about foramen entrapments and lesions causing entrapment at the intervertebral foramen, this is actually a nice little way of articulating it free. Without the wind-up, which when right can be brilliant, when wrong can be devastating. This one doesn't. It takes the risk out of a lot of stuff. Nice in the early, we say, one of your first or second or third treatments in an acute presentation. First or second techniques in your treatment plan. And I'm pushing and I'm letting it recoil. And it's not pushing, pulling, pushing, pulling. It's letting the recoil occur and just then adding over to it or over pressure to it. And again, I have her close to me, so it's not hard work on me. I'm not in her, my knees are broke to take the pressure off my own back. So literally 1 to 2 minutes easily, and as I said, up to 3 times in a half-an-hour session. And I would use it with discs all the time. Right, now can we get you to turn around, because I'm too lazy to walk around. Equally, lumbosacral stuff that you're happy isn't a pathology, isn't a spondylolisthesis or something like that. Can I just get you coming inch close to me? Perfect. This is another harmonic technique, and I would use this again with screaming discs, and I find it incredibly effective. So my superior hand is going onto the ASIS, going to push it away. My other hand is going on to her sacrum, going to push it towards me. So what it looks like, just getting relaxed. I'm just thinking too much. That's it. So you're just trying to get in the zone that you're feeling, and you're in time with this person. I'm not making it happen at my rhythm. I'm listening to her rhythm, what her body was happy to allow occur. So again, that's going back and back and back, and that's going forward. Not going up, not trying to close anything. It's anterior in the PA direction. Not particularly good on her shoulder, but as you're only trying to initiate a bit of a wiggle or a mobilization. It's not hard work. And again, so it looks like there's nothing happening and it's so subtle, but there's actually a degree happening at the junctional area, L5, S1 predominantly. And use my hand. And again, you do that for somewhere 30 seconds to 2 minutes, and again a number of times in a session, depending on the acuteness and the irritability of the session. Okay? So, I'm going to try those two.